Social Services Committee to order. We'll open with Resolution 2018-1402, sponsors Gilmore and Roberts. It approves a grant contract between the Metro Board of Health and the Mental Health Cooperative to provide a secure drop-off location for persons needing a mental health urgent care alternative to an emergency room or correctional facility. May I have a motion?
So moved.
It's been moved and properly seconded. Is there any discussion, or would the sponsor like to speak? Councilmember Virtue, do you have any? Okay, we got Mr. Sharp. Mr. Sharp?
So this was the Community Mental Health Systems Improvement PIP, which started in Mayor Berry's first administration. This is, I believe, the second year of funding. They've broken ground out there at the Mental Health Co-op, which is out at Metro Center, to expand their rapid response, essentially, for when the police pick up someone that's committed some relatively petty crime, trespassing, something like that, but is exhibiting some mental health issues. They don't have to stay with them until they're treated and dealt with and so forth in either ER or the mental health co-op. They can drop them off and go and get back to work. So that's just part of the expansion for that facility.
So how long can they stay at the mental health co-op? How long do they stay there? How long, what kind of resources do they have for them to?
Well, I'm not sure how, well, they're adding, I think, 20 beds maybe, I think, in the first phase. They've been out there already. They have a facility there already. This is an expansion so that they'll have more inpatient beds and they can hold.
So when they pick people up, I'm saying, what's the max that people can stay when they pick them up?
I'm not really sure. That's a good
That might
question.
be under a doctor's supervision or?
Yes, and they one of the things that they're adding is, one of the reasons a lot of them had to go to the emergency rooms is that they would have some sort of actual medical issue. They would have a cut or an injury of some kind, and the police didn't feel comfortable not dealing with that issue. So they now have actual physical health treatment there also, so that they can get patched up.
Yeah, that sounds like a clinic after.
We also
trying to
still
seize
have
it
to
one
process
thing.
But they're not in custody, they're there for assistance.
Kind of like
They can leave on
outpatient.
their own.
All right.
They're there as long as they want to be there or if they're accepting care.
30 days, 40
I
days.
know it's good because we do send quite a few of our people from streetwalks over to
Oh, good.
there, and they do a good job.
Very good.
And we'll have to, I don't know, it's in my district, but I haven't seen or been over, so I'll have to.
Yeah, have to
That's
go.
Go by and check it
That
out.
might be a good thing.
Yeah.
Listen to you. He wants to see it in a different way.
Oh, yeah, I just want to announce. Yeah.
Free to drop by.
Yeah, drop by. That's what I'm saying. Thank you. Good one.
That was.
Yeah.
Any more discussion? If not, then we're ready to vote. How many for? All right, seeing none against, it's recommended for approval to the full body.
Do I need to abstain? I mean, it's just a referral. I don't.
Oh, no, you're good,
Okay.
Yeah, you're good for that. It's only when you're getting money for it through your agency. Yeah, that's how I understand it. Let me clarify, because we're on TV.
Because you may have to refer somebody to a hospital. You don't get paid for that.
That's true.
So Resolution 2018-1403, sponsors Virtue and Gilmore, approves the grant contract between the Metro Board of Health and the Best Friends Animal Society to achieve a safe place of all healthy and treatable dogs and cats located in a safe coalition. Member kennels in Davidson County. May I have a motion?
Someone.
Okay, it's been moved and properly seconded. Is there any discussion?
So they use this money to offer grants to local groups that help rescue pets. The grants are usually $5,000 to $15,000.
Okay. Any more discussion? All right. How many for?
Raise your
All
palm.
right. Cute. Cute. So it's recommended for approval to the full body. Cute enough. All right. The next one is Resolution 2018-1404, accepts a grant from Best Friends Animal Society to the Metro Board of Health to provide pay-it-forward, fee-waived animal adoption event. May I have a motion? Okay, motion probably seconded. Yes, Mr. Sharp.
They have an adoption event around July 4th, and this pays for the, what would otherwise be adoption fees. They just cover the adoption.
Cover the fees.
So where is the event usually?
It's at the shelter.
Oh, okay. Okay. I was asking because it seems like there's one at the Centennial Park, like a big kind of dog.
Arts Retreat has one at Centennial Park. There are a lot of groups that have adoption events of various kinds.
Just like a big old, like a lot of different things with
And I
dogs.
think, I know which one you're talking about. I think we take some animals out there too.
Okay. I mean, it's like a big to-do. They have everything. It's all dogs. All dogs. Okay. So, seeing no more discussion. There's not any more discussion. How many for? All right, seeing none against, it's recommended to the full body for
Barely get
approval.
out of this.
They're having too much fun. Let's see. All right, we got a couple more. Let me hurry on up. Resolution 2018-1405 sponsors Virtue and Gilmore, approves an intergovernmental agreement between the Tennessee Department of Health, the Metro Board of Health, to provide child fatality review service in sudden death of young children under age 19 investigated by the Medical Examiner's Office. May I have a motion?
So moved.
Moved and properly seconded. Mr. Shard?
I'm sorry, which, was that the child death review?
Yes, sir.
So the child fatality review is done under the color of state law, and the idea is to review the deaths of everybody that's a minor, to see if it was a systemic failure or if it was just something, just one of those things. This is money that's specific to what they call SDY, which is sudden death of the young, I think, or sudden death in the young, to give those extra scrutiny when there's not an obvious, it's not an obvious cause. It used to be called sudden death, SID, sudden death, sudden infant death syndrome. So this money is used to give a little closer look to all of those unexplained deaths.
So how do we get a copy of that report or talking about this? It's a big deal.
It's Freddie. Now, their review of things are reviews of medical records and police records and all that, and it is not public record like most of the things that the health
Did you
department
have
does.
something to speak on?
But their reports are certainly, anything you want to see, you're welcome to see. But the incoming data, since it includes medical records, medical examiner's records, and some of that is protected information.
Okay.
But their work product would be public information.
Okay. Yeah, I think we want to see the final work product. I just never forget, a couple of years ago, I had gone to a conference and they just talked about this and how they had put, depending on if they saw certain areas where there were a higher amount of young people that had died in this, that they put resources, they allocated resources in those areas.
Right, and that's another thing that it does, is it tells you where you may have problems particularly. There's another group called Fetal Infant Mortality Review. Those are just a year old or less. They're specific to that, but it's a similar kind of approach to try to see, is it a systemic issue? The people around this table are the State Department of Human Services are there, the social services folks, the police department, the hospitals are there, the medical examiner's office, and everybody that's a part of the system that may well have had a role to play or could have had a role to play in these children's lives is there to look at, did we fail in some fashion, or is there something else that we need to do to redirect what we're doing to try to get.
Yeah, I think that's just good information for council members in general, just to know what's going on in the city, especially when you start talking districts in certain areas. So, I don't know, maybe we can revisit that again in a way to connect and get some of that information.
Sure.
Compare the data from last year to this year, and at least last 2 years that are available.
Yeah, probably be shocking, but
I mean, I guess it's good for research purposes, but it would concern me if there was some form of neglect that was revealed, and, wondering what would be done at that point.
Well, if it's, you mean like physical abuse of the child or something?
Or some neglect, that, case in point, I was in Orlando, Florida, a week or so ago for a conference, and they had a mural of the Pulse nightclub massacre, so to speak. And one of the guys that was there was in the morgue with a tag on. And his sister came in and said that he was breathing. And they thought he was dead. And he was breathing. And they took him out, of course, and got him, and he's well, alive and well today. So I'm just saying,
We'll have to deal with that.
Yeah.
but it, I mean, it was so
Well, the
many that
trauma
they
is,
were dealing with.
it's interesting to bring up. I know that Nashville's constantly doing a study on emergency response and things of that nature. I mean, it's interesting to find out whether or not, the age differences in those emergency situations. I mean, what we all, I think you can kind of figure out statistically the likelihood of being sick or dying under the age of 18 in
Right.
Davidson County, and has that changed at all, one way or the other?
Yeah.
It's good
It'd be
stuff.
interesting to know.
They track,
You know.
they track all
Definitely as we get to be more itty in the itty city. Itty. So let's see how our stats are stacking up for quality of life for people.
That's right.
But he said, yeah, he'll work on that. Okay. Good discussion. How many are for
Crazy
this?
story.
All right, seeing none against it is recommended for approval. To be buried alive is horrible. It's essentially what happens. All right, we have 2 more resolutions. We're almost complete.
It's like
Resolution
find yourself
2018
in a body bag.
Yeah.
It's not a good day.
No.
at all. 1406, this is a nightmare. Sponsors Virtue and Gilmore approves a contract between Infield Management and the Metro Board of Health to operate a mobile unit to provide services to women, infants, and children. We have a motion.
So moved.
All right, yeah.
So the WIC program is the largest program that we run in the health department. It's a federal program. It's a nutritional education program, and they now get, glad to say we've moved into the 20th century at least, they get EBT cards instead of the paper vouchers, which simplifies everybody's life considerably. They just started that last month, I think. But anyway, these are, and so for a lot of the clientele that avail themselves of these services, transportation is one of their biggest issues. And so we have these little Ford vans that they take and do mobile WIC, and they go to churches and all different places around the community to try to get to where the folks are. This is just another addition to that. The infield developments are Biltmore Place on Glastonbury Road and Whispering Oaks on Whispering Oaks Place.
Sounds like it's Antioch.
It's where they are.
It's Antioch.
So.
I didn't hear 12 and 14.
I
didn't hear none of that.
Right.
It's not in Northwest Nashville. All right, well, that's fine.
Right, yeah, or even East Nashville.
Yeah, East Nashville. No, it's not,
That's
yeah.
a good point, yeah. All right, how many, all right, it's recommended for, yeah.
They didn't even hear Maine.
No, didn't hear that. So we're glad
You can't be like me, just start changing street names.
Yeah. Oh, God.
Did they come after you did that?
No, I'm just saying.
Good for you. Resolution 2018-1407 sponsors Virtue and Gilmore, accepts a grant from the Tennessee Department of Health to the Metro Board of Health to promote the proper use of all recommended vaccines and respond to vaccine preventable diseases in collaboration with the CDC and other partners. We have a motion.
Yeah.
All right. Mr. Sharp, it's on you.
That's the immunization program. You know, I didn't check with her. I know that they added some money to us recently for the Hep A response. I think that may be what this is.
And you talking about the CDC, the federal government? When you say us, them and us, just to be clear.
This one-
Okay, I don't know. That's what I was asking. So,
State, Fed, all the same thing.
Well, no, not necessarily.
Is that?
No, this is state money.
okay, good deal. So, how many for? All right, see none against, it's recommended for.
Yeah, whatever.
I didn't know if we see Mark here, if he had something to share from the hospital.
Just wanted to brag a little bit on our, we also have a feeding program for our cancer patients. Oftentimes cancer patients, when they're getting chemo, actually have to have a certain body weight. And if you're too thin, your body can't handle the medicine. So we actually have a special nutrition program where we'll give them literally food boxes that they can take and sort of build themselves up and then get the chemo. So that's been very successful.
That's pretty awesome. I heard y'all got some new beds over there too.
Yeah, new beds.
That's a pretty deal. He's being
chairs.
modest. That's a pretty big deal.
Yeah, that is
nothing like
huge.
in a nice bed versus a spring in your.
Yeah.
So now you don't have the rent beds?
No, we have
To
new.
rent, right?
Yeah, and they're cool. They lift up and all of that stuff. Yeah, I was like, we're up to date now.
Yeah,
So,
that's
I'm
good.
very, very happy.
That's really good. So I just have one more thing to share, and then we'll wrap it up if there's not anything else. I just wanted you to know, as the chair of the hospital's committee, social services, I partnered. We're doing a project called the Nashville Period Project. If y'all want to come out and participate, it came out of a need that a lot of students in Metro Nashville schools do not or cannot afford, and they miss school. They actually miss school. It's not like we think about homeless people, we think about food deserts, but we have a lot of students that miss a lot of days, and especially females. Usually the male counterparts have 145 more days of attendance than the females.
That's crazy.
So if y'all like to come out or partner anyway, please do. The challenge is the 1st through the 30th. And so we're really excited to be a part of that. And I'm finding out it's at a lot of universities too. So, yeah, I just wanted to say that. As we see Mr. Davis, did you have something for the Health and Hospitals Committee?
Thank you. Yeah, I do.
Okay, go ahead.
Thank you, Madam Chair. Just real quickly, the rural hospital closure, I think it's called McKinsey. Do you estimate, is that going to be an added burden? Because I know every time a hospital closes in a rural county, you have an increase in.
We may see an influx, hard to say.
Okay, are
We
you,
didn't expand Medicaid, so
yeah.
one more consequence.
And last but not least, yeah, I'd love to help because we do a program at National School of Arts, my daughter's school, where we collect every year. We call them special napkins,
Okay.
but that's
We'll go with whatever, as long as we give them.
That is a chronic problem.
Oh, wow. Even that, okay, so yeah, they have certain schools that they've identified, they call it achieve schools. And so those are the ones with the highest poverty area. So if you want to participate, let us know. We'll let you know about the challenge at the end if you want to come out. I thought it was appropriate. It's health, and I think if it had been treated as a health issue alone, a lot of women would save a lot of money, right? They're kind of getting over on us. But anyway, I'm not going to get on the soapbox.
Think about how much.
Right, this concludes.
Madam Chair?
Yes.
Yeah.
One thing that we did, you know how like every school year you're supposed to bring a box of tissue for your classroom? You know what I mean? I know because it's a little bit more sensitive than a box of tissue. There's 200 women that go to that school. We get a professional woman like you three right here to donate a special set of special napkins for that classroom. So if there's 100 girls that go to that school, if they can't bring in their own box to share for year-round at the nurse's office, then we ask professional, women to, or even dads or men who want to donate.
I think, and I think it's definitely, we're trying to get men to be more, to take up the cause, because I think at the end of the day, the longer goal is for people that are at the state, it was at the State House last year, to kind of waive some of the taxes off of it, and the bill fell, but that they would be a part of it. And I think if it's just women,
Yes, I do.
Yes.
Just wanted to let y'all know, voter registration drive Thursday the 27th at General Hospital, 10 to 1.
Good.
Okay, thank you so much.
Good stuff. Also, I just have one other thing. Now that we have our vice mayor in place,
Yes.
I know that there will be some committee changes.
Okay.
And I wanted to tell you, you've done a great job for the past 2 years in this position. And, thank you very much for your leadership.
Thank you for that. And I appreciate you guys. You always have a full committee. Thank you so much. A great way to end. Thank you for being vice chair.
You're welcome.
Thank you. All right.